My name is Tina Davis, and I am the director of the Rural Health Clinics. There are 4 rural health clinics located in Ellsworth County. I've been here 5 years now. I am a born and raised Southern California girl, moved back to Ellsworth 7 years ago, and have been part of ECMC again for 5 years. What is most impressive about Ellsworth County Medical Center is our medical staff. I'm in awe of them constantly, the way they interact with our patients. Dr. Whitmer, for example, when he sits with a patient, he leans in, he looks in their eyes. How are you doing today, Jay? He knows everything about their family. He's raised their children. Dr. Slumka is an amazing internist. He is the man I believe that will find a cure for cancer. He's just constantly studying, constantly searching. The mid-level providers are amazing as well. Sean's been here the longest. We have Michelle Brokish, and we have Emily Lindsley, who is an RMP. But they just care about the community, and they're very involved and very engaged with all the activities that occur within Ellsworth County. In a rural community, you actually feel that you have an impact on the patients that you're helping or the community as a whole. Where when I came from a bigger facility, I had a lot of programs that I ran. I did work with patients on the outside, but when you're here in a rural community, you really are impacting individuals. And I think that's the big difference between big city medicine and a small rural community. Probably the most shocking part of moving back here is when you drive your car, people wave at you. Or you're in the grocery store, they talk to you and they visit. And when I first got here, it was like, okay, I've got to go. And then I realized I'm only 1 minute from my job, or I'm only 3 minutes from my home. It's okay to visit with people. But just people actually acknowledging you and genuinely caring about you, that was probably the biggest shocker. First of all, if you are a young provider, MD or a mid-level provider, this is where you want to be, because we're progressive. And I don't say that from just because I work here. I come from Kaiser Permanente. That's my background. We are making strides that are getting the eyebrows lifted at the state level, because we have the largest diabetic program in the state of Kansas through the Kansas Quality of Care Initiative. We are making changes. Blue Cross Blue Shield was just out here on Friday, just blown away at what we're doing here. How far along we are in the patient-centered medical home, in disease management, in preventative care. We want to hear your new ideas that you could bring to us. We're open to that. To me, nothing's ever finished. It's always a work in progress, and we can always do it better the next time. If you're coming here with a young family, this is the safest place to be. But kids play on the streets. You see them skipping down the streets, on the sidewalks. There's a park across the street from where I live, and it's constantly filled with kids playing, having a great time. And so it's safe for your family. It's a good, wholesome environment. There's lots of activities to get involved in. If you want big city feel, it's only a matter of 40 minutes away. And yet, if you want to grow a business or a patient base in a progressive environment, this is where you want to be.